Hi, I'm Dr. Bill Benevento, an ophthalmologist at Eye Surgeons Associates. I'm going to talk about those not so pretty and sometimes painful lumps in your eyelid. The two most common lumps in the eyelid are a hordeolum, which most people call a stye, and a chalazion, or chalazion if you're Greek. Though the two are different, they're treated pretty much the same way. A stye occurs when an eyelid gland gets infected. Styes are really tender, tend to have lots of redness and swelling. A lot of times you'll see a little nodule comes to the head, almost like a little pimple. But you don't want to squeeze it, because if you pop it, it spreads it into the lid and then just more swollen and more red. A lot more irritation. A chalazion is a plugged up oil gland in the eyelid. And if the oils don't flow well or are sludgy, they can back up in the lid and pop the gland. And this causes an inflammatory response, redness, swelling, tenderness, as the body tries to wall it off. Though that may sound a lot like a stye, this is not an infection, just a reaction to those oils being where they shouldn't be. So here's the good news. It really doesn't matter a whole lot which lump it is, because you treat them both about the same way. Hot compresses help the body to get in there and get rid of the infection or allow the trapped oils to get out. You want the compress to be about as hot as you can tolerate. Put it on there and don't burn yourself. You want to leave it on for about 4 or 5 minutes at a time, 4 or 5 times a day. Some people like to use a thermal eye mask instead of a compress. So these are a lot more convenient. You toss them in the microwave for about 25 seconds. They get warm and moist, and you just put it on for a couple minutes. Very easy. You can get them in the optical shop for about 25 bucks. You can also get them on Amazon. This one is from a company called Bruder. Both chalazion and styes frequently drain spontaneously in a week or two just with the hot compress or the mask. A lot of folks with chalazion also have dry eyes because of those sludgy oil glands. Don't be surprised if the hot compress makes your eyes feel better and you keep doing it for a minute or two every morning, even after the little bump has gone away. If the lump doesn't start getting better within a few days or a week, or is particularly painful or inflamed, sometimes we'll put someone on doxycycline. It's an antibiotic that has the beneficial side effect of making the oil glands flow better, so it actually works for both. If it still doesn't work within a couple of weeks, we can drain it, or we can actually inject a little anti-inflammatory around it. The vast majority of patients recover nicely from these things. They occasionally cause a little scarring, but usually it's really not significant. But sometimes there are other lumps that aren't so benign. Rarely, a skin cancer can look a lot like a popped stye or chalazion. So if that lump doesn't go away within a couple of weeks, or if it bleeds or gets worse, give us a call and we'll bring you on in. So that's what you need to know about these most common lumps in the lid. If you're concerned about a new bump, or it's not going away, or you just want peace of mind, feel free to give us a call and we can always set you up with an appointment. Thanks for watching.